So I know that the mayor of Shreveport
Yeah.
been on the phone with y'all trying to explain the situation. What's the latest?
Yeah, I can tell you, and I appreciate Mayor Perkins and Mayor Walker both. We, as a hospital system, we've got 5 large hospitals. We have 3 in Shreveport. We have 1 rehabilitation center that sits on Line Avenue, and of course, then we have our Bossier facility. And we started experiencing, like everybody else in the Arklatex, low water pressure yesterday. And the only difference is it's starting to impact patient care, not just at Willis-Knighton, but at Christus, at LSU and Oxnard's, and the entire health system for Northwest Louisiana. As you know, a lot of therapies that involve patient care involve water as well. And so when that water is not available and you can't flush a commode and you can't provide water for dialysis and those critical things, then that starts becoming a healthcare crisis. And right now, this is a bigger healthcare crisis than COVID-19 for the health systems of Northwest Louisiana, is being able to have water, not just to provide those patient services, but to also keep the facilities heated as well.
And so what are you guys doing right now?
Yeah, we're working with both cities to ensure that the health systems of both communities in Shreveport and Bossier have priority in being able to have at least whatever water pressure is available. And right now, I can tell you that I've got about a third at each one of my facilities of the pressure that I normally have. I was just notified at my north facility that there's no water pressure on the 5th or 4th floor, and it's starting to work its way down. The only place that I've got even a little bit of water pressure now is on the bottom floors of each one of my facilities at Piermont, at Bossier, South, and at North. And so we're working with both cities and their water departments to see if there's any opportunities to valve down any non-essential areas, whether that's residential or commercial that's non-essential, to make sure that the hospitals are provided whatever pressure is available. And of course, a lot of this is attributed to it's all attributed to the cold weather. The main breaks, the water leakage that way, but it's also attributed to everybody in their households got a little bit of water running to keep their pipes from freezing. Well, when you've got 60,000 households in Shreveport and you got 30,000 in Bossier that are doing that, it diminishes the water pressure. I was on the phone with Pam Glorioso from Bossier just a few minutes ago, their CAO, and they're pumping out about 20,000 gallons of water, and 20,000 gallons of water is getting used, or 20 million gallons of water is getting used as fast as they can pump it out. And so when that happens, you can't build up any pressure. And so that creates a challenge. And so what we've done in our health system, we've canceled everything that is non-emergent. So from cancer treatments to hemodialysis, outpatient physical therapy, all of our clinic offices are closed. And we're only focusing and saving those resources that we do have in the way of water for only those emergency cases. And the biggest issue we have healthcare wise right now across all of the systems, and speaking to Mayor Perkins last night at midnight, and has really taken this to heart and is doing whatever he can in the city, and so is Mayor Walker. They've been working around the clock with us, is dialysis patients. Dialysis is something that we can't put off. Some physicians can move it a day or two, but those patients have to be dialyzed, and they require large amounts of water to push the machines that operate that dialysis through their systems. And so when that happens and you can't do that, it creates a medical crisis, and that's what we're having to deal with right now. So I know that we're working with Martha White with Public Health, and Knox Andrus, who's the Region 7 representative, is also having conversations with the governor. He's been involved in the crisis that's going on here, and they are looking into supplying tankers of water from the National Guard that's going to be coming up from South Louisiana to help us, fill the gap between now and the time that the water becomes available to us again, maybe later on this week. And we've also been working with the Shreveport Fire Department. They've done a great job. Chief Wolverton and his crew have come out to our north facility and our other facilities a number of times and filled up our water coolers, which help us heat our facilities as well. So it's all hands on deck here. We've got an emergency operations center set up in our north facility, and that's kind of where we're at right now. So we're just keeping our fingers crossed that the situation doesn't get worse.
Absolutely. And I know that everyone can play a part in this. For those who, unless it's absolutely necessary, that they get on the road or get out of their house, or you asking people to just stay at homes, stay safe, try not to get injured and cause even more influx.
Yeah, Chandler, you said it all right there. I mean, I can't. All of our facilities are full. We're at capacity in Bossier and Shreveport right now. I'm holding about 60 patients in my emergency departments that I don't have beds for right now, and so those are, anything from chronic illnesses to acute illnesses, cardio, respiratory, flu. We're seeing it all right now. But if you don't have to get out and you don't have to come up to the emergency room and it's not an emergency and you can self-medicate or self-treat at home, we urge you to do that. I mean, obviously getting out, I drove in this morning about 6:30 with the sleet coming down, and I've got a 4-wheel drive truck and I was sliding all over the place. And so we caution people not to even get out of their house, especially if you're elderly. Get out there, you slip on the ice going, outside just to kind of take a look, you break your hip, and the next thing you know, you're in the emergency department. So it's better just to kind of hunker down there at your house, stay inside, stay safe, stay warm. And if it is emergency, call 911, obviously. And we're still here to take care of you at Willis-Knighton.
Of your healthcare workers, are they sleeping, staying at the hospital, and what are they able to use right now?
Yeah, God bless them. I can tell you all of the above. And that's, other challenges is staffing, coming to and from the hospital. So what we try and do is we have rooms that are not patient ready rooms, but they're rooms that somebody can sleep in, somebody can, change clothes and those types of things. So we have put up hospital staff, nurses, physicians, respiratory therapists, even administrators, spending the night here to make sure that we've got adequate numbers of staff to take care of the people that we do have on hand. But obviously it's a challenge. And we've got an administrator right now picking up a dialysis nurse that lives in Bossier to make sure that she can get to the hospital and she can care for those patients. But that's the quality and the dedication for, not just Willis-Knighton, but healthcare workers, across this community have to make sure that the people here are being taken care of. So some of the toilets and the commodes are still flushing, but we're putting, mitigation measures in place. Those table size. We're also looking at porta potties coming in for staff, possibly being positioned outside the hospital. So we have that resource available. And so that's one of the things nobody wants to talk about, but that's an issue when you don't have the water pressure to be able to actually flush the commode out and make that happen.